Hello, everyone, and welcome back to this series of episodes on drugs that are used in arthroplasty patients. In this episode, we're going to learn about the group of drugs that are used in patients with rheumatoid arthritis, mainly focusing on when to stop these drugs prior to the surgery. So, if you actually see, these group of drugs are classified into two things. One is disease modifying anti-rheumatoid drugs, and then TNF alpha inhibitors, sometimes also called as biologicals, okay, monoclonal antibodies. Now first let's discuss about DMARDs. The most commonly used DMARDs are shown here, that is methotrexate, hydroxychloroquine, leflunomide, azathioprine, sulfasalazine, cyclosporine. When patients are on these drugs, liver function and renal function has to be monitored, and there are specific adverse effects with each of these drugs. And among these DMARDs, most DMARDs can be continued and need not be stopped prior to the operation, except for leflunomide, which is advised to be stopped 1 week prior to the surgery. Now let's discuss about the TNF alpha inhibitors. They are etanercept, adalimumab, infliximab, certolizumab, golimumab, rituximab, abatacept, and tocilizumab. So they have to be stopped prior to surgery somewhere between 2 to 6 weeks. You can see here that etanercept has to be stopped 2 weeks prior to surgery, whereas adalimumab 3 weeks, infliximab 6 weeks, certolizumab 6 weeks, golimumab 6 weeks, and rituximab can be continued, and abatacept for 2 weeks if it is given in subcutaneous, or 4 weeks for parenteral, and tocilizumab 3 weeks for subcutaneous and 4 weeks for IV. So this is in brief about the different drugs that are used in rheumatoid arthritis patients and when these drugs needs to be stopped prior to the operation. So it is very much essential that one would seek rheumatologist's opinion and accordingly plan the surgery if the patients are on these drugs. So this is the reference for this information that is provided in this video, and thank you very much.